Thank you, and thanks everyone for sticking around. Anyone in the back there that wants to come up should do so right now.
Beautiful.
Is everyone well? Put your hand up if you're well. Awesome, well done. So what are the benefits of pursuing a wellbeing strategy that focuses on a whole person? We've managed to find 4 whole people up here to my left, so that's pretty good.
Speak for yourself.
Whole people on stage. So we've really got every part of wellbeing covered today. We've got Moira, who's a recovery expert, started sleep science in 1994, and has taken a year off to be the CEO of the Sleep Health Foundation. So everyone else takes a year off and goes to Bali and stuff, but not on this stage. We've got Megan Clark, who's looking after learning and academia for us, which is the Associate Director of Wellbeing at the University of Newcastle. Skye, Buatava, learning and society and government, I should say. So the big picture here is if we can get our organisations and our government right. She's the director of the Centre for Work, Health and Wellbeing, and a big fan of taking research and turning it into practice. And that's one thing we want everyone to take away today, is there one small thing. And Jessica Doyle, bring up the rear in terms of physical environment. We know that environment shapes what we do every day, and at BGIS, she's the Health and Wellbeing leader. So for all the people working there and within all their facility managers, businesses, we get the opportunity to influence their health and wellbeing. And I'm a health and wellbeing strategist. So we're just going to go down the food chain here, and there's going to be a lot of conversation, but I wanted to start with the word wellbeing, because often we talk about health and wellbeing. Wellbeing is the kind of stuff we do when we're flourishing, and I just wanted to say, what does wellbeing mean to you?
Okay. So I think wellbeing means so many different things to different people. For me personally, it's about quality of life, which good quality of life, and there's so many factors that go into that. Generally though, mental health, physical health, community, social health and wellbeing. So getting the right combination of those, hopefully, will lead to good quality of life.
Thanks, Jess. I don't disagree with that, but I think I'd probably take it a little bit further as well. Being in the tertiary education sector, we have a really broad range of staff that are involved in that environment, as well as obviously young people that are coming out of school and entering tertiary education as well. But the thing that I've noticed sort of post-COVID in particular is this idea of connection, and the lack of connection and the different type of connection that we're needing to make now, and how that can really impact our wellbeing as a whole. So for us, it's really about how do we get connected again socially and definitely from a holistic perspective. Skye?
Yeah, no, I agree as well. And I think that the key word there is that it's an individual thing. Mm-hmm. So I absolutely concur with my previous colleagues, and that's why it can sound complex in trying to tackle it, and we're going to get into that. But I think because it is so individual, the key to that is communication and trust.
So last but not least, I would add that wellbeing is your ability to be well, and that it's a complex thing, and it doesn't mean that you're without injury or without health problems at times. That all of us, even well-being, means that you're going to have some difficulties at times. And I think just to pay tribute to our First Nations people and their concept of health is that you're only as healthy as the mob. They don't see it as an individual thing. And I think that wellbeing is although individual, of course, it's individual factors, but it's really the whole of society, and certainly for sleep, which we'll get into, because sleep's my bias. It's really is these whole of society factors, not just the individual.
Right, I think, that bigger picture society, mob level thing is really important, and observational learning from each other is really critical. So if we talk about wellbeing, there are so many pillars we've got to choose from physical, mental, community, career, spiritual, etc., etc. What would you like to talk to today?
They're all pretty important. I really like the point that you made about connection. So I would echo your thoughts there. That sort of, it touches on, all those other pillars of physical, mental and social. But if you can implement wellbeing strategies that have that connection element to it, people like that, and it has multiple benefits. So I'll underline what Megan has said here today.
Yeah, and again, just to build on that idea of connection, I think for us in particular in our wellbeing strategy, the right element at the right time is always difficult. So like most organisations, we have a monthly theme or a calendar of events that we put on through the year, but we sometimes find ourselves having to tweak that because it's not the right time to do that piece depending on what else is going on in the organisation. So when we think about it from a strategy perspective, not only is it connection for that person, but to your point, Skye, it's how we individualise those programs so it is right moment, right time for those strategies. Yeah.
Yeah, I think the other one, just to pick up on, and Moira, you alluded to it, is that we all have our own stuff. And you're not going to be at 100% and perfect all of the time, which is that element that you need to ensure you're thinking about. But, you know, if you think about that from a strategic perspective, which is why it can be complex or challenging, you need to create that safe environment, that safe work space in order to be able to get that out. Everybody has something going on, whether it's a physical ailment or stuff going on at home. If you don't incorporate that into the strategy, and there's certainly ways that we can get into as to how you do that, then it doesn't matter what else you do, it's not going to work.
Yeah.
And sleep world is it's a bit more basic even. We just want to, in terms of strategy, we just need to be at the table. And you'll see in your own workplaces, your own life, your children's school, your curriculum when you studied, sleep has not got the attention it deserves yet. There's actually no sort of legislation, no policy level. In the National Preventative Health Strategy in Australia for 2020 to 2030, the first version had not one word of sleep in it. And a few of us got our hands on it, and it's got a couple of words of sleep in it. And then the National Women's Health Strategy, for similar, has still to this day has not one word about sleep. Like women's health, think about menopause, think about postpartum, think about when you have your period, etc., the hormonal changes. So sleep hasn't got the attention it deserves yet. So I suppose we in terms of, it's really a basic need of having conversations about sleep and bringing sleep into your conversations at home, conversations at work, and beyond just the, sort of a mindfulness app or something, which of course are important, but sleep is really complex and it's way more than a racing mind. There's a lot of complex factors that we haven't understood yet, and which we won't unpack in the next 22 minutes.
It's a really good point though, isn't it, that we think about, trying to get the best out of our people, and if you think about the amount of money that we invest in attracting the right talent and, setting ourselves up for success in whatever you do, we need to incorporate all of these elements, right? Because you could have the best person in the best job at the best time, and if they've got something going on and they're not sleeping well, or they're not eating well, or they don't have time to exercise, or their work is overloaded. So this is where it all kind of connects. You've got your psychosocial risk, you've got your general well-being, the day-to-day stuff going on outside of work, as well as all of your work factors.
And extending that into the injury space when we're supporting people that are unwell, either from a work-related perspective or from the things outside as well. So I think it's difficult to build a strategy that is holistic for everybody at the right time, at the right place. But I think as employers, we have an obligation to do something to try and support people. We're a long time at work, a long time sleeping too, but a long time at work. So trying to make that the best environment, I think, is really important.
I'm liking this, Angie. Did you notice I started the question when all the way?
And now it's back at you again.
Legs can wave.
So look, I want to pick up on sleep a bit more here. So I like the idea of a good night's sleep starts the moment you wake up. So I wake up at the same time every day, walk the greyhound, rescue greyhound by the way, have a swim and then start my day. But I think legislation can help. We're seeing in France, obviously, the right to disconnect. So we've got this multi-layered approach to wellbeing. So as an individual, what we can do at an organisational level, and then at societal or government level. So I'd like to go down there and back again.
Sleep.
What's the question? Sorry, Duncan.
So would you like to comment on what part you'd like to play on the individual, societal or organisational level
Okay.
to promote good wellbeing?
Okay, so embedded into a organisation, in my role as health and wellbeing lead, I would absolutely see the connection between the individual and the organisation. So our programs are aimed at individuals, and we have, you know, measures and KPIs to make sure we get engagement, to, you know, measure the results from that. But my role is to advocate for that in my workplace and to sell it to my organisation. There's always competing priorities, so I need to package that up and report it to my executive leadership team to demonstrate why is this important for business. You've got all these things that you need to concentrate, productivity, new work coming in the door, but why is this important? So I try very hard to make the connection for healthy, engaged workers are good for business, and they're good for business because if they are healthy and engaged, they're going to have good relationships with team members. That's a win. A big pillar for us as an organisation is innovation. If people aren't feeling healthy and well, they're not going to want to innovate. They're not going to want to go the extra mile and the extra step. So good for the organisation as well. And then employer of choice. If they're not healthy and engaged, are we going to be an employer of choice? No. So that means that we can't retain good people and attract good people. So that's my little connection between employees and execs.
I want to say sleep's my superpower. Just to add that piece, I'm a bit like you, Duncan. I really value sleep. Mother of 3, now that they're older, I feel like I haven't slept for 22 years, but that's I'm a master of it now. But when I think about wellbeing from that sort of individual, organisational and societal perspective, I really think that, this is going to sound really challenging, but from a wellbeing strategy point of view, we need to continue to empower individuals for what they need for wellbeing when they need it. Because I think we've sort of moved into a space where the employer goes, and here's this, and here's this, and here's this, and all the wellbeing pieces that we put out for them. And then there tends to be this expectation, particularly for, I think there was a mention earlier about the workforce of the future, where you don't just come to work to do your job, you come to work to you know, gain the benefits of the organisation. But there also needs to be an individual responsibility for wellbeing. And I think in your work, Duncan, where you think about your entire day, it's not just these employers' responsibility in that space, it's actually the individual to take some ownership of that and take some time to plan what their day looks like and how that impacts their wellbeing. And that then extends into family life and social life and what the expectations are at a societal level of what you'll deliver in that space and how you'll continue to be a healthy and well person outside of the workplace as well.
Yeah, like we were talking earlier about volunteering, surf club movement, etc. If you're at work the entire time, you don't get to do what you love. So, you know, considering that whole of life wellbeing is really important.
Yeah, absolutely.
Yeah, and look, there are some obligations, you know, whether you're talking about from a legislative perspective or you know, that is handed down quite often through our principles-based legislation to the organisation. That is more important in some areas as opposed to others. So if you think about, you know, drivers, for example, you know, fatigue and shift work and rostering, that's all really, really important, and there are obligations absolutely on the organisation. I do agree with you though, Megan, there's also obligations on the individual. But I think we've also got to think about, you know, this more agile environment in which we work now, and flexible working has been a great example. You know, where I've had team members who have chosen to do the pick up and the drop off with the kids, spend time with the kids in the afternoon, help them with the homework and things like that, which sometimes means they're doing emails at 9 p.m. And they've had some good chunks of real flexible work in the day, and that worked for me and it worked for them. But, you know, Duncan, going to sleep at 9:30 at night, that wouldn't have worked for my colleague there. And I wouldn't be looking to prescribe that. Because that's what worked for him and his family. So, you know, we do need to be agile, we need to be smart. The legislation literally says, you know, that we all have a role to play here and we all have a responsibility. And from a governmental perspective, you know, in New South Wales, we've got 370 workplace health and safety inspectors and 1 million workplaces. If the system doesn't work together, as in if workers don't take their responsibility, if organisations don't take their responsibility, and beyond associations, researchers, we all contribute to this system, then we don't have an impact, we don't prevent harm.
Yeah, so much to say, I have to be succinct. I think that there's a lot of individual responsibility with sleep to know what works for you, because there's so much individual variation with our response to caffeine, our response to stress, our response to light, our sleep needs. So there's a big variation of anything between about 6 through to 10 is considered normal. So there's these individual things you should value it and prioritise it where you can. So that's all we can really put in the individual. And then the societal is really, like safe work practices, minimum in between shifts. There's just so much to do. Education. Like we haven't had a campaign in the same way we've had with, say, Life Beginner about exercise, and about, say, the healthy food pyramid for the general public to know about healthy food. We haven't had anything yet with sleep. In fact, there's all this sort of misinformation, and a lot of people, so the cart's come before the horse with Fitbits and the like, and there's lots of talk. I mean, I'm asked to speak about sleep every week, all the time, but there's not really we don't have funding. Like Sleep Health Foundation, for instance, is unfunded, like 10 years of asking government for some funding. So it's sort of an awareness campaign would be really important, that don't worry about how much hours, not just, duration's one thing, but the depth and quality and the consistency. So I'm hoping that we'll have this sort of slip, slop, slap kind of equivalent, that people can really understand sleep really much better. And so we're all working like the partnership of government and researchers and clinicians, the general public industry, to come together and make some sense of sleep, because I think we've got this advantage. We're in our infancy compared to other topics. Even mental health. I remember mental health was just not in work and safety. Like at my first career as a nurse, health and safety was slippery floors and bad backs. And now most of it's about mental health and safety. And so I think that sleep's coming, but we can learn from the mental health story and other health areas how to do sleep really well, hopefully. So that's why it's great to be invited to speak about it.
Just for the record, I'm not encouraging anyone to go to bed at 9:30. And that's the thing
if you want to.
The thing about wellbeing is it's bespoke to every single individual. So I want everyone to think more broadly about their wellbeing, please. So we're now going to move into the freelance section. So if people are going to take something away from today, where do you think they should focus their direction in terms of helping bring your whole self to work and wellbeing?
Okay, you gave me prior notice of this question, which was good, Duncan. So my bit of take-home advice is, over this conference, there's been so much good information and you're full of ideas and it's wonderful. And then you get back to workplace and you're like, my goodness, where do I start? And something that's really worked for us as an organisation is picking anchor wellbeing campaigns. So we've got together our leaders from big sectors of the business, and we've sort of said, look, here's some baseline information about wellbeing, about our workforce. Can we possibly pick 3 or 4 anchor wellbeing campaigns for the year? And we've tried to tick off on the things that were important, like those 3 pillars of mental, physical and social community health, connectedness, and said, they're all wonderful, but let's pick the top 3 and 4. And then we've absolutely gone for it with those campaigns. And the recognition of those campaigns is wonderful. I'm part of a health, safety, environment, quality team. When we go out and we talk to the business, people's recognition of like, oh, we saw that wellbeing thing, that was really great. And so it's really driving the message home, and we're getting really, really good engagement. So that's my take-home message. Pick the things that you think, this is a big win. Can't do everything, can't be perfect, but pick the big wins, get your people involved, say that's what's important to us, and go for it. Thank you.
And getting them curious about their wellbeing as a result.
Yeah, that's right. It's going to be a knock-on effect, because all of a sudden now they're like, oh, I will look at those other things. And gee, like 300 people joined in Move It for May. So next year, I am going to bring more people and it grows from there. Whereas if we spread ourselves too thin and there's so many things going on, don't get the same level of engagement or recognition. So that's what's working for us.
Thanks. We've been working on our wellbeing strategy specifically since 2020, of which, as I said, COVID put a big hole in the middle of, and we had to sort of change focus with that. I think the take home, if I'm talking about it from our perspective at the moment, and I know there are lots of people out there with diverse workforces, is we've sort of got a strategy, I guess, that does focus holistically, that we have all those elements of wellbeing within our wellbeing program. But what is really missing for us at the moment is the connection. Where the university environment in particular, people are employed there and they come there for very different reasons. So it's really hard to find a single purpose that everybody can connect to. So in that way, to get engagement, we need to actually reignite that connection with the universities. So if you're finding that your participation rates aren't great in your wellbeing programs, it might be time to sort of sit down and start asking the question again around what do people need right now. And that's certainly what we're starting to do through our health and wellbeing committees, our health and safety committees. But certainly in things, we've got a very strong Indigenous community as well, our yarning circles and the like, really understanding what connects people to the university again. So I think if your strategy's lagging, that's probably the place to reconnect with your people and work out what it is that they need at the right time.
Try and jump into a bit that we haven't really touched on, and I think it's off the back of that connection comment, but I reflect on my own team as well. I had the benefit of being able to set up a team from scratch a couple of years ago, and the key benefit there, and it propagates, no matter which way you look at it, the diversity of what we do, the way in which we approach things, but it is that diversity and inclusion, which needs to be a part of every wellbeing element, because if people can't bring their whole self to the workplace and have that sense of safety, then again, you're really starting from a place where you're not going to be able to move her forward. But it's the communication and the connection. So, I knew I had a win really early on in setting up this team when they said to me, one of the team members one day came and said, look, Skye, I need to have a mental health day. And I was like, well, that's fantastic and I support you, and that's absolutely the way that it should be. And that's the culture in which we created, because we created a safe space. So we're talking very high level strategy. Unless you get the basics like communication, connection, and that psychological safety, then you're really going to fail. Not only at looking after your workforce and having a productive and successful workforce, but also back to the previous point from Jessica about that real innovative environment. Takeaway, just two really quick things. This is all based on total worker health. So if you want to Google something, Google NIOSH and total worker health. They came up with the original concept out of the States, and that is there and available. What we're talking about now is decades old. And they were the first to break ground. Don't get me wrong, I don't think they've necessarily nailed the implementation, but as it relates to the research factor, it's there. The other thing I'll just plug from my perspective, the Centre for Work Health and Safety is the team that I set up a few years ago. We have a lot of free assets available online, and they're all backed by evidence and research. So go and check them out. There's things like a mentally healthy workplaces work redesign kit, which gets you to look at the whole person.
So my take-homes would be just to make sure that you incorporate sleep in a really meaningful way into any wellbeing, health and safety you're doing in your workplace or for yourself personally, your own personal wellbeing strategy, and that you can't look at sleep in isolation. It has to be this holistic approach of, at the very least, thinking about sleep and diet and exercise as the key three pillars that underpin all the rest of optimal mental and physical well-being. So, and knowing that you can't kind of do it all at once. I think, Jess, I like you to pick your one win, and you're probably not going to think, I'm just going to just incorporate sleep, because we're in our infancy. You've got to wait. There's not many sleep experts out there. A lot of people will tell you that they are, but we know from the field that it's an emerging thing. And in terms of even psychologists, GPs, physios, all the health people, the average is 1 hour of study in their undergrad and postgraduate studies on sleep. So there's not a lot, and that's the average. So 47% had zero. I personally, I was a nurse for over a decade. I've been a psychologist for over 2 decades. Most of the stuff I've learned about sleep was recently, in the last 20 years, by self-funding, going to conferences and running, and then I ended up accidentally becoming this sleep expert because there's not many others out there. So it's really important to not simplify sleep and not to reduce it down to sort of hours of sleep or sleep hygiene. One quick takeaway, the word sleep hygiene was coined in 1977 as an off-the-cuff thing out of something like this by Professor Peter Howry, who's now passed away, and it just stuck. And nobody really likes that term necessarily because if you look at the list of do's and don'ts, a lot of it's quite prescriptive and it's not individualised. And if you've already got a sleep problem, like a sleep-specific anxiety, and you're quite worried about sleep, don't give someone a list of sleep hygiene because it'll accidentally ramp up their hyperarousal. They'll be, I must do this and I must not do this. Whereas in general, it's a bit like healthy food pyramid is general good principles, but if someone's got a quite severe eating disorder and you gave them the healthy sleep pyramid, the healthy food pyramid, that's going to overwhelm them and puzzle them and think, oh my goodness, the experts gave me something that wasn't very helpful because I've already tried all that. I've got I've got sort of some disordered thinking and some preoccupation and obsession around my sleep. Or perhaps I've got I've got a sleep apnea I didn't know I had. You know, I thought it was just snoring. So there's lots of complexity with sleep that's coming. I urge you just to be very careful who you get into your workplaces around sleep, not spooking us because we can't go to every single workplace. It's going to be digital things anyway. Our website is being rebuilt, launched soon, and there'll be really good free resources. At the moment we have 100 fact sheets on a range of different topics. So everything from jet lag to babies and elderly and shift work. There's specific sleep hygiene guidelines for shift workers on our website that we remain a little bit hidden. So our job is to come out and be visible. So that's a long take home.
I'm disappointed to hear that sleep hygiene is not a thing, so I try and stop drinking by 5, don't drink coffee after 1, no girl with a dragon tattoo, no reading before bed. I'll have to reassess all that. So we've shared some things that you might actually do tomorrow. It might be worthwhile sharing one thing we're going to do, because obviously we've had a big day preparing for our talking day. What's one thing we're going to do to enhance our own health and wellbeing so we can bring our whole self to work tomorrow? Mine is my natural thing. I swim at the Bowl and Beautiful at 6:30 every morning, so I get in the freezing cold water, and that's where I start my day.
Definitely the thing that I'm going to try to do is more self-care. So I was on the round table with Mello, and it was an amazing sort of discussion about the importance of self-care and boundaries. So that's the takeaway action for me.
And again, I'm going to build on that. You know, the old adage, fit your oxygen mask before you can help others. That's absolutely my mantra again. At the moment, I say again because I used it years and years and years ago. But I think for me, the one thing is really connecting with my family again. It's been a very busy time, and my children are getting older, and I think suddenly, I need to start spending the time with them as well. So really looking forward to that each day.
I might skip that question because really, do as I say, not as I do. I'm the worst on every scale here. Too much coffee, no sleep, too much work. No.
So modelling the behaviours you want to see, Skye.
100%. No, but I will actually just hopefully bring us back to the strategic element here. And the one thing that I've seen, whether you're talking about a work health and safety strategy or, it's something as targeted as wellbeing, is whenever you're working with your business to try and establish something like this, we all know measurement's absolutely crucial. But I go one step further and say when you are looking at building your strategy, don't build an individual work health and safety or wellbeing strategy. Incorporate it into your business strategy. And that is so crucial, whether you're a small business and it's the management team looking at it or the manager individually, or you're talking about a boardroom. If it's a separate strategy, you won't get traction. If it's part of the business strategy, it will. So I'm going to say that instead of what I'm going to do.
So that's really interesting. So alignment with the company vision, the individual, and everything like that.
Incorporate.
And I think you're doing something well, Skye, with your wellbeing. You probably don't need to commit. You look healthy. Caffeine's obviously treating you fine. And my commitment will be just to get back to Pilates and to do more of that. I've got sore upper back, and I just think, you know what, I've been working too hard over a computer, and I'm going to commit to moving my upper back more and getting back to that.
Thanks everyone. Please put your hands together for this wonderful panel.